So today we are going to study about the fracture healing. So what is the rate of repair? Usually based on the type of the bone, if it's a cancellous bone, it can heal faster than cortical bone because which highly vascularized. And then the type of fracture, either is a spiral fracture, which is heal faster than the transverse fracture. And then the state of the blood supply. If poor circulation, then poor healing and causing slow healing. And then general constitutions, which is either the healthy bone, causing a faster healing in age, 2 times faster in children than adult, and the amount of movement at the fracture site. So what are the average time for the fracture healing? Usually if a callus visible in upper limb, 2 to 3 weeks, same with the lower limb. If union, the upper limb will be between 4 to 6 weeks and lower limb is 8 to 12 weeks. And if presence of consolidations, the upper limb could be 6 to 8 weeks and lower limb is 12 to 16 weeks. So what are the first method of healing by callus? Usually in the first method, this one is the first method, usually a secondary bone healing, which is indirect bone healing. In mobile bone, which is the absent rigid fixation, the step one is the tissue destructions and hematoma formation, and then causing inflammations and cellular proliferation. Then callus formations subsequently become consolidations and remodeling. Callus is what we call is the response of a movement at the fracture site. It serves to stabilize the fragment as rapid as possible, necessary preconditions for reaching by bone. And then less direct, need proliferating cells to form cellular mass together with woven bone and immature cartilage forming callus, but ensure mechanical strength while bone and healed. And what is the second method of healing without callus? This is the second method, usually primary bone healing, which is direct bone healing. In immobilized bone, which need rigid fixations, no need for callus. New bone formations occur directly between fragments. Gap between the fracture surface invaded by new capillary. Bone formation cell growing in from age, and then narrow gap less than 200 micrometer, causing osteogenesis, produce lamella bone directly. And then if it's a wide gap filled by woven bone, there's a gap healing. Then before remodeling to lamella bone. And if a bone healing depend on the metal implant for its strength due to absence of callus. As implant diverts stress among the bone, reduce weight bearing of bone, and then bone not fully recover until the metal prosthetic removed and bone may become osteoporotic. And how to test testing for fracture union. Impossible to tell from clinical and extra features precisely when bone fragments have joined. More important than what patients want to know, do fractures shows sign of healing? When bone strong enough to withstand normal load of a fracture site on a fracture site. And what are the encouraging signs of healing? First, if there is absence of pain during the daily activities, absence of tenderness at the fracture site, absence of pain on stressing the fracture, which is gentle bending movement, and then absence of mobility or at the fracture site. Extra sign, there is a sign of callus formations, which is bone bridging across the fracture, and then trabeculations occur across the whole fracture site. And how to know if the fracture internally fixed. There is a callus formation, usually sparse, and then definitive X-ray sign, which is trabecular continuities, and wait several months before removing the fixations implant. And what are the first step in a fracture healing by callus? The first step, which is the tissue destructions and hematoma formations. The tissue damage and bleeding at the fracture site, which is hematoma formations, and then bond and die back for a few millimeters, site becomes swelling and painful. And what are the second step? Which is inflammations and cellular proliferations, which is within 8 hours, inflammatory cells appear in hematoma, proliferations under periosteums and within breech medulla canal. And then fragment and surrounded by cellular tissue, which breach the fracture site. And clotted hematoma slowly absorb and find new capillary growth into the area. And then what are the third step, which is the callus formation, which is soft callus. The cell change to osteoblast or osteoclast. Osteoblast is synthesis of the osteoid, and then osteoclast is reabsorb of the dead bone. And then formations of immature bone, which is woven bone, form callus or spleen on the periosteum and endosteal surface. And then woven bone more densely mineralized, movement at the fracture site decreased, fracture began to unite. And then process driven by inductive protein, which is fibroblast growth cell, transforming growth factors, bone morphogenic protein. And the fourth step is consolidation, which is hard callus. A woven bone transformed to lamellar bone. Fracture had united. Osteoclasts burrow through the debris at the fracture site, and osteoblasts fill remaining gaps between the fragment with new bone. And then the last step, which is the fifth step, which is remodeling. Newly formed bone remodeling to resemble the normal structures by continuous process of alternating bone reabsorption and formations, causing thicker lamella lay down at the increased stress area, unwanted buttresses which is carved away, and then medullary cavity which is reformed. Thank you.